Well, I think we'll get things underway. So, good morning. I'm Marcus Pugh. I'm Head of Fundraising at RCVS Knowledge. It's my pleasure to introduce Tim Mair, who I'm sure a lot of you know, who wears a number of hats. He's your speaker, he's my trustee, and he's also today's sponsor. I have to say, we had to twist his arm quite hard to sponsor his own session, such as the modesty of the man, who said, I don't really mind. But seriously, the EBVM initiative would not be possible without the support we're getting from across the veterinary community, and our sponsors are playing a big part in that, not just in the funding and support they're giving us, but in the many of the conversations I'm having, it's clear they see themselves as part of the veterinary community like yourselves, and moving ahead with the conversations. So we're very grateful to them in all sorts of ways, not least of which is the fact that Tim's able to promote what he does here today. Should you be interested in any of our sponsors, many of them are exhibiting upstairs, but all of them have adverts in our handbook, so you can find details there. Okay, that ends the commercial break. So now, without any more hesitation, I introduce Tim Mair. Thank you very much.
Thank you very much. Good morning. I'd like to thank RCVS Knowledge for inviting me here, although, as usual, I'm now regretting accepting that invitation. So, my name's Tim Mair. I'm a horse vet, basically a simple horse vet. I work in practice. Oops, I've lost the slides. I work at Bell Equine Veterinary Clinic, which is in Kent. Sorry, hit the wrong button. And I'm also editor of Equine Veterinary Education, which is a journal of postgraduate education for the British Equine Veterinary Association and the American Association of Equine Practitioners. So my remit this morning is to talk about how to critically appraise a paper and how to run a journal club. And I think for many of us in practice, myself included, the actual concept of critically appraising research papers can be a bit daunting. But the appraisal of papers is obviously central to the practicing of evidence-based veterinary medicine. And I think in the vast majority of cases, if we use a common sense approach and follow a systematic format, then it's possible for us to appraise most of the papers that appear in the veterinary literature. So we're all familiar with the concept of evidence-based veterinary medicine, which involves the integration of our individual clinical experience with the expectations and values of our patients and our clients with the best external evidence. So to practice evidence-based medicine, we need to have specific questions that we're going to ask. We then assess and search the literature. We read the literature, and then we decide on its quality and relevance. And then if it's appropriate, then we can use that evidence and the results of those studies to change our clinical practice or affect our clinical decision-making. So critical appraisal really involves carefully reading appropriate papers. And we're doing this for a number of reasons, but we want to identify bias or error because this affects the validity of the study. So in other words, we want to try and assess whether we think that this study was performed appropriately, whether the materials and methods were followed appropriately as well, whether it's likely to give useful and valuable results that we can then use. So in this process, we're trying to basically identify any bias or error in the study. We want to understand the significance and the magnitude of the results, whether they've achieved statistical significance or, more important to us, whether they are clinically significant. And then to assess, once we've done that, whether that knowledge, whether the results we can then use and apply to our own patients. And that's termed generalizability and applicability. So the critical appraisal process, I think, involves these 5 elements. The first question we have to ask is, what is the research question being asked in the study? Then we need to assess what is the design of the study, because different questions are more appropriately addressed by different designs of study. So we need to understand what the design of the study is. Then, importantly, we need to assess the study's validity. So can we rely on the results of this study or those studies, and can we then use those results in our practice? So we assess the validity of the study, assess the study's results, and then assess how we can use the results. That is the generalizability and applicability. So the first question may be obvious, but we need to ask, what is the research question? What is the purpose of the study we're reading? Now, usually that's identified fairly easily from the abstract And if it's not in the abstract, it should be in the introduction of the study. But in some cases, there are lots of questions and outcomes being assessed in one study, and sometimes it's a bit difficult to see the wood for the trees. So it's important to try and hone down what is the primary research question that's being asked in this particular study. And for many studies, well-designed studies, you can use a PICO format, which I'm sure most of you will be familiar with. But PICO is breaking up the question into these different categories. So first, the P stands for patient or population. So what patients or populations is actually being studied in this paper. Then we look at the intervention or the exposure. So what type of intervention or what treatment is being applied and being studied. And if we're assessing some sort of treatment, for example, then there needs to be a comparison. So we have a group that's being treated or a group that's not being treated with this particular treatment. And then the O stands for outcome. So for most studies, we should try and break up the question into this format. So identify the patients, the intervention, the comparisons, and the outcomes. So as I said, in a number of studies, there will be lots of secondary questions and outcomes, and that can confuse the issue. So the next question then, once you've decided what is the question being asked in the study, is to look at the study design. And we'll talk about different study designs a little bit later. But there are a number of study designs that may be useful to us, and we can break them up into these different categories. So we have evidence synthesis. These are basically studies that bring together, summarize other studies, and hopefully come up with some conclusion. And we'll talk about systematic reviews, knowledge summaries, and so on. Then there are experimental studies, so basically the controlled trials, which may be randomized or may not be randomized. And then there are observational studies. So these are like epidemiological studies, cohort studies, case control studies, cross-sectional studies, and others. And remember that the best study design will depend on the type of question that's being asked. So once you move from determining the question and the study design, we then have to try and assess the validity of the study. And this is probably the most important part of the critical appraisal process. So validity refers to the degree to which a study accurately reflects or assesses the specific concept that the researcher is attempting to measure. In other words, does the study design, do the materials and methods and the way the study is carried out actually answer the question that the researchers were posed in the first place? Because if there are problems, errors, bias in the design of the study, then it means that the results may not be valid, which means that we may not be able to rely on the evidence in our clinical decision making. So we need to determine, was the study conducted so that the results are true for the sample of patients that are being studied. And remember, all studies will look at samples. We can't study the whole population of animals in one go, so we take a sample. And we need to try and establish that the results that come from studying that little sample of animals will be able to apply to the general population that we're interested in. So during this part of the appraisal, we're really looking for bias or errors in the study design. So bias then is basically a systematic error or a deviation from the truth or in the conclusions. So in other words, the results are not true or they're not believable or they're erroneous, which obviously affects how useful that study is to us. And bias can come into studies in various different places. Common places where bias will creep in are in sampling methods, the methods of data collection, the methods of statistical analysis, the methods of reporting. So bias or errors in any of these areas will produce results that are erroneous, and that may then result in the conclusions but either underestimating or overestimating the truth. And of course, they'll vary in magnitude. So some bias is likely in most studies, but it may not be that important, whereas other areas of bias may have a significant effect on the conclusions of the study, which therefore affect how we can rely on that evidence. And different types of study will be susceptible to different types of bias. So we have three common places where bias creeps in. And these are selection bias, performance bias, and detection bias. So in selection bias, it's where we select the individuals or the groups that we're analysing in the study for data analysis in such a way that that sample obtained is not representative of the population that we are intending to study. So if we are interested in a study on heart disease in dogs, for example, and we picked a sample of dogs, we need to make sure that that is an appropriate sample that we're using and it's not biased in any way, so the selection process isn't biasing us towards one particular subdivision or subgroup of dogs. I always think of horses, of dogs with heart disease. Then there's performance bias. So once we've got our groups, our sample of the population, performance bias is where there's a systematic difference between the groups in the care that's provided or in the exposure to factors other than the interventions that we're looking at. So we've got our groups of dog and we divide them into two groups and we're going to treat group A with one drug and we're not going to treat group B, or we're going to treat group B with a different drug. But if there are other differences between those groups in how these groups are maintained, then this will introduce bias because we're not comparing like to like. And then detection bias really is basically systematic differences between the groups in how the outcomes are determined. So again, we've got our two groups, one's treatment with drug A, one with treatment with drug B. If there are any differences in how we're actually assessing the outcomes of these different groups, then again, this introduces bias. So poor reporting is another issue. So although many papers in the high quality veterinary journals that we're going to read will undergo peer review, the peer review process is not perfect by any means. And so still studies are published where the reporting is poor and there may be missing parts of the study design that aren't described effectively in the paper. So if there's missing descriptions of the type of animals used in the study, or no clear description of the diagnostic methods used. So if they just say horses with overriding dorsal spinous processes, if they don't actually clearly state how they made that diagnosis, then you can't really assess the appropriateness of the results. Inappropriate documentation of treatments and outcome measurements. So any areas in the materials and methods in particular where the description of the actual how the study was carried out is incomplete, means that we can't really assess that study effectively because we don't know all the facts. And that has a serious implication on our ability to critically appraise. So remember that an invalid study may not be worth reading. And many people would suggest that if you're going to critically appraise a study, you start with the materials and methods section, because that's the most important section where you're going to assess the validity of the study. So if you find flaws in the materials and methods, it really means that you can't rely on the results, and that may be to the extent that this paper is not worth reading in the first place. So bias, although it can cause underestimation or overestimation of the true effects, in most cases will result in overestimates of the truth. So once we've been through that process, we then need to assess the study's results. And this is where statistics come in, and this is obviously where a lot of practitioners especially find it difficult, because a lot of clinicians don't understand statistics and they don't have the right mind to think about statistics, myself included. But most articles published in veterinary journals will have undergone some sort of peer review, and a lot of veterinary journals have a specific statistical peer review process. So one would hope in the better journals where we're reviewing articles, that the articles, if they involve complicated statistics, that has actually been assessed by someone in the review process, or by the editor, or by a statistical peer reviewer. But we can basically, the statistics in the results section basically comes into two areas. One is descriptive statistics, so that's really defining the population that was being studied. So it's defining that little sample population that is being used in the study, what those animals are, their age, their breed, and so on. So really describing what they are. And then there's a comparison or inferential statistics, which is where you compare the results from different groups. And as I said, this is where sometimes we come unstuck because we don't really understand some of the statistical methods that are being used. So the final step then is, once you've been through this process, is to try and assess how useful the results are to you. And this is called generalizability and applicability. So generalizability refers to which patients would this apply to in the future. So you've read a study about heart disease in dogs. Can you use this information that you've gained from this study, assuming that you think it's a valid study, in your future practice? So if the next dog that walks through with this particular type of heart disease is the results of this study, can you use it clinically? Does it have generalizability? Applicability refers to, does the evidence gained from this study actually apply to a patient you're dealing with now? So in this situation, you may have a patient with a disease, you ask a clinical question, you go through, search the literature, find the studies that you want to look at, you appraise them, and then decide whether you can use those results here and now on that patient or that group of patients that you're dealing with. So it depends why you're reading the paper in the first place. Is it simply to keep up to date, in which case the generalizability of the results is more important, or are you finding an answer to a specific question relating to a specific clinical problem that you're dealing with, in which case it's the applicability that's important. So you need to ask these sort of questions. Do the subjects that are being studied look like my patients? Can I transfer the information directly into my population of patients I'm dealing with? Does the outcome really matter? And this is where statistical significance and clinical significance may vary, because just because something is statistically significant doesn't necessarily mean that it's clinically significant. The difference between two outcomes in two groups may be so small that it doesn't actually have a clinical impact. And so the bottom line is, can I use these results in my own clinical practice? So the importance of critical evaluation, then we're all trying to provide the best possible patient care. We're trying to optimize the use of our diagnostic tests and our therapeutic interventions. We're trying to optimize our risk-benefit ratio, our cost-benefit ratio, and we're trying to provide our clients with accurate prognosis. So we talked a little while ago about the types of study, and it is important, as I say, to have some understanding of the different types of study design. Now, in most cases, this will be quite clear from the abstract or the introduction to the paper or the materials and methods as to what type of study you're dealing with, but it isn't always clear. And fortunately to us, there are various toolkits available that allow us to assess studies if we're not clear what the study design is. And RCVS Knowledge on its website has a number of EBVM toolkits, which some of you may have seen. But these can be really useful in the evaluation in our critical appraisal of papers. So EBVM Toolkit 4 basically asks the question, what type of study? So this is a study design algorithm. And by answering a series of questions about the study you're looking at, you can come to the conclusion what type of study it is. So the sort of questions it's going to ask is, does the researcher have control over which animals are exposed to the intervention from the start? So it's basically trying to peel out those controlled trials. Is the researcher looking for an association between variables by observing the situation or the patients without directly intervening? So these are the more observational studies, the epidemiological studies. Or is the aim of the study to validate a test or a diagnostic method? So these are diagnostic test validation studies. Or is the aim of the study to review all the literature and to give advice? So these are the information syntheses, the systematic reviews and so on, which are summarizing the results from other studies, which you can then use to answer questions that you have about clinical decisions. So the other thing that's important is the level of evidence. And wherever possible, if we're making changes to our clinical practice, we should use studies that have the highest possible level of evidence, or the strongest level of evidence. So it's also important to assess this during the whole appraisal system. However, simply because a study design gives you a strong level of evidence doesn't mean that that study is valid. So all designs are liable to methodological problems that can affect the validity. There is no such thing as a perfect study. There are limitations to every study. Now, often the limitations of a study are discussed by the authors in the discussion part of the papers. But remember, there is no such thing as a perfect study. So all studies are open to bias and problems and errors. So we'll be familiar with the evidence pyramid, where systematic reviews are at the top of the evidence pyramid, then followed by randomized controlled trials, then the observational studies, so the epidemiological studies, so cohort studies, case control studies, and so on. And then lower down are the case series and case reports, and then at the very bottom are editorials and expert opinions. So in terms of the level of evidence, this is a rough estimation. But of course, the level of evidence for a particular study depends on what the question is. So we can divide our questions that you have clinically into these sort of 6 main areas. So our question may relate to treatment, or it may relate to prognosis or risk or diagnosis or prevalence or incidence. And to some degree, the level of evidence provided by different study designs vary depending on what the question is. But for all of these questions, the systematic review and the meta-analysis is going to provide you the strongest level of evidence. But if we don't have systematic reviews available, and there are many, many areas where we don't, then we need to look at lower down on the level of evidence. So if our question relates to treatment, then we're going to look for randomized, ideally for randomized controlled trials as the next level down. Or if they aren't in existence, then we look at some of the epidemiological studies like the cohort studies. For answers concerning questions about prognosis or risk or prevalence or incidence, then in the absence of systematic reviews, then we're going to look at these observational studies like cohort studies, cross-sectional studies, case control studies. If none of these types of studies are available, then we have to go down to the lower levels and case reports or case series, or finally expert opinion or consensus. So we'll just briefly discuss some of these different types of study designs. We've heard this morning about the Cochrane collaboration and the systematic reviews. So systematic reviews use rigorous methods of collating, summarizing information from published papers that address our particular clinical question. And the methods used to search the literature, assess the quality of the papers, to make conclusions are explicitly stated in the methods section. So it's a scientific approach to summarizing the results of lots of different studies relating to the particular question that we're asking. So how do systematic reviews vary from narrative reviews? Well, systematic reviews, as I say, use rigorous methodologies to review the scientific literature. And the objective of that is to reduce error and reduce bias. So it's a comprehensive literature review of a particular area of question that identifies, appraises, and synthesizes all the relevant studies on that particular topic, and then formally and openly reports the results, the sources, as well as the search strategies used to find those studies. Narrative reviews, on the other hand, do not involve that explicit systematic searches of the literature, so they're not as robust. They tend to cover just a subset of studies based on either the availability to whoever's writing that narrative review or the author's bias or the author's selection. So there is selection bias in what studies are usually evaluated in narrative reviews. However, they can certainly be informative, particularly in situations, of which there are lots, where there are no systematic reviews available to us. But we have to remember they're not as robust as systematic reviews. So where can we find systematic reviews in the veterinary world? These evidence synthesis of systematic reviews are available. The University of Nottingham Centre of Evidence-Based Veterinary Medicine publishes and summarizes systematic reviews on its website. In equine world, the Equine Veterinary Journal and Equine Veterinary Education, who have been publishing or attempting to publish relevant studies in evidence-based medicine, have put all these studies together on their website, available online called Clinical Evidence in Equine Practice. And then Veterinary Evidence, that's the journal that's going to be launched by RCVS Knowledge, will be publishing systematic reviews in the future. So these are just a few examples of some of the systematic reviews that are on the Nottingham website currently. So, although systematic reviews give us a nice, clear indication of all the studies and they summarise the results of studies, we still have to appraise these studies if we want to rely on the results and the conclusions. And again, the RCVS website have these toolkits. So one of the toolkits, toolkit number 10, relates to a checklist for systematic reviews. So it's going to ask questions such as this. Did the review address a clearly focused question? And this question really is really important for all studies we're trying to appraise. Did the authors select the right papers? Do you think the search would have found all the relevant important papers? Did the authors do enough to assess the quality of the included studies? If the results of studies have been combined, was it reasonable to do so? What are the overall results? How precise are the results? Can these results be applied to your practice? And this, again, is another question that we should really apply to all studies that we're appraising. Were all the important outcomes considered? And are the benefits described worth the harms and costs? The next type of evidence synthesis are variously called clinically appraised topics, or CATs, knowledge summaries, or best bets for vets. So these are much more focused questions. So they're unbiased reviews, again, of the current best evidence, but on a very specific clinical topic. So the objective is to produce quick and an achievable method of incorporating evidence into our clinical practice. They're not as comprehensive as systematic reviews. They don't cover wide areas. They're really focused on a specific little clinical question. So we can find examples of these in the veterinary world at various sources. So veterinary evidence, which is going to be launched today, I believe, will summarise what's called knowledge summaries. Here's an example of one. So in this case, I had to put a horse one in, I'm afraid. In reported cases of iatrogenic laminitis in adult horses and ponies, is the therapeutic administration of systemic corticosteroid associated with the onset of laminitis? So this is the clinical question. It's trying to put it into that sort of PICO format, so the population or patient are horses and ponies. The intervention is the administration of corticosteroids, and the outcome is laminitis. So having appraised all the articles that were found that address this sort of question, they then come up with a clinical bottom line. And in this particular case, it states there is currently no conclusive evidence to support a causal association between therapeutic systemic corticosteroid administration and the development of laminitis in healthy adult horses and ponies. But there is a weak evidence of an association between administration of multiple doses of systemic corticosteroid and the onset of laminitis in adult horses and ponies with underlying endocrine disorders or severe systemic disease. So, although it states there is no conclusive evidence to support an association between corticosteroids and laminitis in healthy horses, that doesn't mean there isn't an association. It just means they weren't able to find an association in the available evidence at the time. So we always need to remember that absence of evidence is not evidence of absence. And this will apply to a vast amount of questions that we ask in the veterinary sphere, because there just currently isn't enough evidence out there. That will change. It is changing. But if you don't find evidence of an association, it doesn't mean it's not there, it just means we have no evidence. Here's another example. This is from the Nottingham Centre for Evidence-Based Veterinary Medicine, so that they call these best bets for vets. And this one looked at the age of neutering bitches and the subsequent development of mammary tumours. So the question, which is put into the PICO format, is in bitches being spayed, that's the patient, does surgery before the first season, that's the intervention, compared to later, that's the comparator, reduce the risk of mammary tumours, that's the outcome, obviously. And by looking at the studies relating to this question, they came up with the conclusion that spaying bitches before the first or second season or before the age of 2.5 years may be associated with a reduced risk of developing malignant mammary tumours later in life. This reduction in risk appears to be most marked in bitches spayed before their first season, followed by those spayed before their second season. However, the evidence is relatively weak, and this should be taken into account alongside other considerations when recommending whether and when to neuter. And here's a horse one from equine veterinary education. Again, we've been trying to published what we're calling CATs, and these are available, I'd say, online on the Clinical Evidence in Equine Practice collection, which is an amalgamation of articles from both Equine Veterinary Education and Equine Veterinary Journal. So the question in this one, are IV fluids useful for the treatment of large colon impactions? A really practical question for us in equine practice. The conclusion then from analysing the studies that relate to this question was that intravenous fluids are beneficial in rehydrating the ingesta of the normal and dehydrated large colon, but whether this trait translates to a clinical benefit in the treatment of a horse with a large colon impaction has not been established, so there is no evidence. A randomised prospective clinical trial to evaluate the use of different doses of IV fluids is required, and study design would ideally include an untreated control group, but of course that's probably not ever going to happen. So moving on then from the evidence synthesis, we have experimental studies, and in particular controlled trials, which may be randomised or not. These are basically interventional studies. They're assessing a treatment and comparing with either with some other treatment or some other intervention. So we have two groups of subjects which may be randomly allocated either to the intervention group or the control group, and the control group may receive no treatment, or it may receive a placebo or the current best treatment as a comparator. Ideally, these studies will be blinded because this significantly reduces the risk of bias. And again, there is a toolkit available if we're appraising controlled trials, asking questions like, did the trial address a clearly focused issue? Was the assignment of the animals to treatments randomized? Were all of the animals who entered the trial properly accounted for as a conclusion? Then onto the observational studies or epidemiological studies. So cohort studies, this is, I say, where you have exposed and unexposed groups or cohorts that are followed over a period of time, either retrospectively or prospectively. And then at the end of that study period, we look at the outcome, for example, of the presence or absence of a disease, and we measure that and then identify risk factors associated with a disease, and these can be used to estimate incidence of disease and prognosis. But they're not randomized, so they are liable to bias, which is the same also with controlled trials that don't have randomization. Evidence toolkit number 9 is appropriate for looking at cohort studies. So again, ask these sort of questions. Does the study have a clearly focused issue? Address a clearly focused issue? Was the cohort recruited in an appropriate way? Was the exposure accurately measured? And so on. Then case control studies, these are another type of epidemiological observational study. These are generally retrospective. You're comparing animals with the disease, the cases, with a group of animals that don't have the disease. These are the controls. And then looking at the animal's history, you can identify risk factors. These tend to have a lower level of evidence than cohort studies because they're more susceptible to bias, but they can still provide us with good evidence about risk factors. And again, there's a toolkit available for us to assess or appraise these sort of studies. And then the last type of observational study is a cross-sectional study, where you study a sample of the population at a single point in time to identify the diseased or non-diseased group, and then look to try and determine the prevalence of the disease, and also to produce odds ratios showing relationships within the disease or non-disease group to a specific parameter. And again, these studies have a toolkit available. In cross-sectional studies, there is a lack of temporal sequence of risk factors, so it's much more difficult then to produce a likely cause-effect link. Then, of course, we have case series and case reports, which are lower down on our evidence pyramid. These are purely descriptive. They're describing the presentation, diagnosis, treatment, outcome of an animal or a group of animals, but there are no disease-free controls to compare with, and differences in management and treatment are randomly allocated. So it's difficult from these studies to produce any sort of cause-effect relationship or to be sure that any treatment or intervention was successful or not. And then finally, at the bottom of the pyramid, we've got expert opinion and consensus, where one individual's opinion or the position of a panel of experts is used to try and answer a specific question. It may provide some evidence. It can be useful, especially when there's no other information available. But remember that the level of evidence from expert opinion is quite low. So going back to this diagram, I think it's important to remember that practicing evidence-based medicine does involve the integration of all of these areas. So our individual clinical expertise, the patient or client's values and expectations, and the best external evidence is all important in making our clinical decisions. So the fact that we may have absence or very poor best external evidence available doesn't mean that it doesn't work. It just means that we have to understand that there are areas where there is no evidence, and this can affect, obviously, how we appraise the results of studies. So this is just a light-hearted, which I'm sure some of you were familiar with, a study that was published in the British Medical Journal, to make the point that evidence-based medicine doesn't always work if you rely purely on external evidence. So this study, entitled Parachute Use to Prevent Death and Major Trauma Related to Gravitational Challenge, that is, if you fall out of an aeroplane, a systematic review of randomized controlled trials. So the objectives were to determine whether parachutes are effective in preventing major trauma related to gravitational challenge. It was a systematic review of randomized controlled trials. They used these data sources to find the evidence. Studies were selected when they showed an effect of using a parachute during free fall. And the main outcome was death or major trauma. So the results, we were unable to identify any randomized controlled trials of parachute intervention. So they concluded then that, as with many interventions intended to prevent ill health, the effectiveness of parachutes has not been subjected to rigorous evaluation by using randomized controlled trials. So advocates of evidence-based medicine have criticized the adoption of interventions evaluated by using only observational data. We think, therefore, that everyone might benefit if the most radical protagonists of evidence-based medicine organised and participated in the double-blind, randomised, placebo-controlled crossover trial of the parachute. Okay, briefly to finish then, I was asked to talk about journal clubs. I think journal clubs are an effective way of linking research and practice together. And they are appropriate to the practice of evidence-based veterinary medicine. It allows us in groups, in practices or institutions or people with like-minded interests to keep abreast of relevant literature that's being published. It involves critical review of important and current research. It allows networking of colleagues of various seniority, and within the practice, it's very useful to get everybody in together who can, of however long-standing or whatever position they may hold in the practice, to come together and discuss clinical issues. It allows the development of critical appraisal skills. It promotes academic debate, and you can use these journal clubs to discuss appropriate papers which then help us to generate our practice guidelines or to assist us in developing clinical audits. So we can have those face-to-face or they can be online. It's important to try and hold them at regular intervals, to try and set times that are convenient to most of the participants. That may be a tall order because we're busy people and finding a time that suits everybody is virtually impossible. We need to, basically the participants all need to share a common clinical interest. So if it's in a practice, then you get a group of practices who are all interested in the same sort of area. If in our practice, we're all equine vets, so it's easy. We all sit down together and anyone is invited to participate. And some people suggest you need a facilitator, that is someone who can focus and really drive which way the discussion's going. I'm not sure that that's absolutely necessary. But the chosen articles do need to be relevant, so you need to be careful about what articles you're going to choose so that you basically feed to everyone's interests. The articles need to be circulated prior to the onset to the actual meeting, and these days that's easy to do electronically. And if you're having a face-to-face meeting, then having food available is a really good way of encouraging people to attend. But the format of the journal clubs, I think these areas need to be discussed. You need to introduce, whoever's presenting the paper needs to introduce it and say why we've chosen this paper. You need to describe what the title of the study is and who the authors were. Discuss what the question of the study is, ideally in a PICO format. And then appraise what the evidence base is already. So what do we know about this subject already? Then discuss the study design and go through the appraisal process that we've already been through earlier. So study type, study population, randomization, bias, inclusion, exclusion criteria, and so on. Decide whether the method was thorough, discuss the results, and then have a general discussion about the interpretation, the strengths and weaknesses of that paper, and then try and put it into clinical context. So we need to decide, okay, we've appraised this paper, we've discussed it. Do we think we can use the information here to change our clinical practice? So in summary then, critical appraisal of papers is an important component of evidence-based veterinary medicine. I've discussed these 5 elements which I find useful. So what is the research question? What is the design of the study? Assess the study's validity, assess the study's results, assess the study's generalizability and applicability. Consider different study designs, and we've been through all of these. And then in terms of journal clubs, a really useful way to link research and clinical practice to keep up to date, to build our appraisal skills, to appraise current literature, and integration of new ideas into the practice, and they can be fun. So thank you. I think we have time for questions if anyone has. If you have a question, could you use the microphone? Thanks.
Thank you very much for an interesting talk, Tim. Just a point in terms of journal clubs within businesses. How do you work it in terms of copyright and people getting access to journals? Because I think this is always a big debate about if I sign up personally for access to, say, RCVS library or things, am I allowed to then print off copies or email copies of journals around all my colleagues for discussion?
I don't ask that question. I don't know the actual answer to that, and maybe people here who have a better understanding of this. My view is that it's more important to discuss this sort of stuff than worry about red tape and what's right or wrong. But again, I'm sure that there will be people here who have a better idea of the answer to that. Does anyone want to comment?
I think the general concept is that it's acceptable to pass on up to about 20. General concept is that it's acceptable to pass up to about 20 copies if you own
20.
a copy. Yeah, okay. It's kind of, it's not written down anywhere, but it's kind of the general concept when we looked into it. So
you could circulate electronically to 20 people
within a group. Yeah,
or 20 groups within a.
Yeah.
It's all a bit vague, isn't it?
It's difficult, I mean, it's a risk for organisations trying to implement
this
sort of thing, because although you say you think this is more important,
and
I can absolutely agree this is more important, it's more important until someone challenges you and you've broken the law. Copyright law. I think it is a real challenge for many of the larger veterinary organisations, and I don't know if RCVS Knowledge can provide guidance on that, because it is hard to find a black and white answer as to what's acceptable and not.
I think that's a really useful point. I think we should try and do that, and we should approach the publishers of the main publishing houses and get their views on this. So over there.
Hi, thank you. Really just to add, this is why it's so important that we support journals that have an open access policy like veterinary evidence, because then anybody, whether that's a member of the public, a member of the veterinary team, etc., can all access the journal articles and discuss them. And I think that's going to lead to driving forward evidence-based vet medicine.
Yeah, completely agree with that. There's obviously a move towards open access, but I think it's going to be some time before it filters through to a large degree, and a lot of the journals are based on different financial techniques and methods, and they rely on income from other sources. So although it's feasible in certain areas, I think it's going to take a long time before it really becomes a major player in veterinary journals, I personally think.
Great talk, Tim. Thanks very much.
Thanks.
Can I just ask, in your practice, so you talked about having it quite often and encouraging people to come. How often do you guys do a journal club, and what percentage of your practice do you get along, and what have you found gets people's bums on seats, and what maybe doesn't?
So we actually try and do it weekly, and we do it at between 7 and 8 in the morning. I guess it's easy for us because the most people who generally attend our journal clubs are people who work in the hospital, and we're usually busy at those sort of times. Well, we start work at 7, so, some of us. And we have a lot of students, and actually involving students I found to be really helpful, because the students coming through now are trained in appraisal techniques and they understand the process, whereas it was never part of my veterinary training. So it took a long time for me to kind of realise the importance of it. So the younger members tend to support it better, if I'm honest. But if it's a subject or an article that appeals to other people, then they'll join in. But I think it'll grow slowly. But we do it that way and it works. It would be nice to I can't say we get everybody involved, we don't. But I'd say in time I think it'll grow. But and have you got any other ideas how to stimulate people's interest in journal clubs?
Sorry, just a really quick question. Are your vet nurses getting involved?
Some of them, yes, we do encourage that. Anyone's welcome to come to the journal clubs. And some of them do, sometimes, not always, but yes. Yeah.
Do you rotate around? Oh, sorry.
I'm afraid we're out of time.
Okay. Thank you very much.